Hello, bonjour, and welcome to ACJ Remapped, a special Prep Doctors panel discussion. Today, we're going to be discussing a new and revamped way to prepare for the ACJ exam in 2023 and beyond. My name is Uthman Quick. I'm the Marketing and Communications Manager here at Prep Doctors. And today, I'm delighted to have with me some of our senior dental faculty, starting with our co-founder and Chief Learning Officer, Dr. Marwan El-Reyes, ACJ Course Director, Dr. Khalid Arim, and ACJ Instructor, Dr. Zulfika Al-Rubai. Before we get started, there's a few quick housekeeping items to go over. Firstly, today's webinar is recorded, and a version of that will be sent out to everybody who's attending here live. Secondly, the doctors will be taking live questions at the end of the webinar, so you can go ahead and start asking your questions using the Q&A button at the bottom of your screen. So let's dive straight into the discussion with a quick overview from Dr. Marwan El-Reyes.
Thank you, Uthman. Thank you very much, and welcome everybody to this webinar. So today we are actually going to focus on ACJ, but the idea is we are going to have a couple of topics to discuss. The first thing we're going to focus on is what are the timeline and preparation challenges that people are now encountering with ACJ. Then we're going to go into the features of the new course that we have remapped, and we're going to talk about the financial challenges that people are encountering, not specifically in the ACJ phase, but in the process overall, and how to start preparing ahead and what Prep Doctors has to offer. So the vision of Prep Doctors actually is, now that we have this years of experience dealing with the internationally trained dentists trying to go through this process, is to help guide people as early as possible to not only prepare for exams, but to actually organize their lives. Because one of the things that we see is when people come to the last exam, which is one of the most demanding exams, the NDEC exam, that's when we start to see people who are struggling financially, they have exhausted the financial resources, and this all happens because there is a failure in planning that took place early on, and we are trying to change the way that people actually think about this process, because people usually think about it one step at a time, and we don't want people to think about it in one step at a time. We want people from the beginning to start to think about the end goal, becoming a licensed dentist in Canada. So if we start from ACJ, you're going to have a better outcome when you come to the final stage of NDEC, and that's what we want to focus on today. But focusing on ACJ, we do have some issues with ACJ itself that started to emerge more after the COVID era, which is now it is very unlikely that people who are in the AFK phase, when they write their AFK exam, they're not able to actually capture the ACJ cycle that happens right after the AFK exam, which makes people wait for a longer period of time, because ACJ is only offered twice a year. So people actually start to wonder, how can we prepare? What should we do in this period of time? Should we start early on? And what should we study, and so forth? So these are common questions that we always get, and it has become almost a pattern that people will have to wait at least, I would say, around 9 months in order to be able to secure a seat for the ACJ. Some people even from the last AFK, they had to wait longer to secure a seat. And in the meanwhile, this appears as a disadvantage to people, because of course you're incurring costs, life costs, you're incurring, you're getting bored because you just want to move on with the process and so forth. And people are starting to get more anxious. So what we want to do here at Prep Doctors is actually come up with a plan that on a financial and organizational level, that will help people actually prepare and be at ease when they go actually to the next phase. So to overcome the challenges with the ACJ, I am going actually to pass the mic to Dr. Khalid, who's going to talk about the features of the course, because one of the challenges also of ACJ is that people, they want to be prepared well for this course that does not actually have a large amount of knowledge to study, but more of a practice to implement. And people don't want to actually be always faced with surprises when they go to the exam. So they want to be prepared and they want to cover all aspects. So Dr. Khalid, I will leave it to you so you can speak about the features and what did we do to actually overcome this challenge.
Thank you, Dr. Marwan. Hello, everyone. Welcome. Thanks for joining our webinar. So to pick up on what Dr. Marwan is saying, in the past period, we've been working to think about how we can optimize our ACJ course in terms of how we can provide the best training possible and the best preparation possible for our candidates when they attempted the exam. And with this ACJ exam, there's multiple challenges involved, namely the fact that your timeline on when you will be able to do the exam is a little bit unpredictable. So in the past, if you would do the AFK exam, if you do the AFK exam and you pass, you would be able to do the ACJ exam within like 3 or 4 months after passing the AFK exam, meaning immediately in the cycle afterwards. But nowadays, with limited seating available, with longer wait times until the AFK results come out, there's a little bit of uncertainty that arises with that. So that's one of the challenges. As well as the fact that when it comes to preparing for such a pivotal exam and such an important step in your equivalency process, it becomes very important to also be able to cover all of your bases, meaning that you need to be very, very well prepared so that no matter what you face in the exam, what kind of clinical case you face in the exam, you would be able to tackle it. Now, people who have finished the AFK exam and now they're moving on to ACJ, by the time you've finished AFK, you have actually done a vast amount of studying, you have amassed a lot of knowledge, you've covered a very large amount of material on different topics in dentistry. So when it comes to the ACJ, it's not that you actually need to learn new information or new science all over again. It's about how do I take this information that I have from AFK and how do I implement it onto the ACJ exam. So I'm going to talk a little bit about the nature of the ACJ exam, and I'm going to talk about what we're doing with our course to actually tackle this exam head on and how we plan to do that. So the nature of the exam itself is not similar to what the AFK is. Where the AFK is a straightforward multiple choice question exam, the ACJ is a clinical based exam where you will be faced with mainly 2 components, the cases and the radiology. So when you're attempting the exam, you will be presented with different patients with different medical histories, different pathological conditions, undergoing different dental procedures, emergencies in the dental office, and so forth. And so after they present you with that patient and their medical and dental history and all of the relevant clinical information, you will be asked questions relating to this case. So questions in terms of how would you manage this patient from a medical management perspective. For example, if the patient has a dental ache or a toothache, how can you diagnose that? What is the endodontic diagnosis, and so forth. So that's one component of the exam. And the second component is the radiology component, where you will be asked questions on multiple radiographs like periapicals, bite wings, panoramic radiographs on different radiographic findings, including like caries and calculus and common radiographic findings we face in the dental office, all the way to pathologies that you may also see on dental radiographs as well. So in terms of the actual material that you need to know for the ACJ, it's definitely not something that is more extensive than the material that you need to know for the AFK exam. The thing about the ACJ is the way that this knowledge is implemented is in the form of clinical cases. So it's not just about studying and learning the information very well and memorization. It comes more down to actually practicing this format of the exam very, very well in order to be able to tackle it in the actual ACJ exam. So how we tackle this, or how do we what can I say? So how do we tackle this for during our course for the actual exam? Is that we focus not just only on the material and the topics and the information that you need, but we also put a large emphasis on providing a lot of practice. And a lot of practice includes practice on many different types of cases from all aspects of dentistry, which I will get to in a second, as well as practice on as many radiographs as possible, because as the saying goes, of course, practice makes perfect. The reason I will say the reason we have expanded the time of the course is because this will give us two advantages mainly. This will allow us to actually introduce and discuss and teach a wider variety of material and different topics, as well as it gives us the opportunity to be practicing all of these different topics all the way until your exam. So instead of practicing for a period of 2 or 2.5 months, you will be now practicing for a period of 5 months. So that extended period, I believe, will give a very big advantage in that regard.
Okay, so we will be talking about new topics that I think you guys have included in the course.
Yeah.
But I just want to mention one thing before, and this is to address the people. So most of the time, people in their nature, they're reactive. So we have two modes of teaching. Either you overteach or you underteach. And the best mode is to overteach, because if we actually look at the outline of what topics to be covered in ACJ, you will find these topics are actually listed in their outline.
Yeah.
So they do say that pediatric dentistry is to be covered in the exam. They talk about preventive, they talk about oral surgery, but whenever actually we teach these topics, one of the things that the candidates were saying is that, like, this is an overkill. This is something that's not focused on. Why are you teaching us stuff that we don't need? Until it shows up, and then they appreciate actually what we are teaching. But if you want to elaborate more on, because now we're expanding the course, the topics, we're going more in depth, I believe, with this course on top of what we teach.
Exactly. So the first luxury we get with this expansion is that not only do we have more time to practice, but we have also a lot of time to go in depth into these different disciplines. And so, again, covering all bases is basically the only way to approach this very important step in your equivalency process. So with this expansion, the first thing we've done is that we have incorporated these topics extensively into our ACJ course. So these topics are namely pediatric dentistry. So for example, in this topic, we will be going in depth into discussions on how to endodontically manage pediatric patients, treatment planning for different types of pediatric cases, extractions and space maintainers, and restorative dentistry for pediatric patients, as well as preventive dentistry, where we will be discussing things like caries risk assessment and preventive regimens and guidelines, as well as restorative dentistry. That's also a whole other topic that we're adding. So again, restorative dentistry in general, how to manage different levels of caries or different stages of caries, and restorative treatment planning in the dental office. And we also have added a section that discusses oral surgery, for example, like complications that arise during surgery, a section on trauma as well, so guidelines on management of traumatic dental injuries, and a section discussing temporomandibular joint disorders. So that's the first thing we've done, where we've added these these topics. So I'll give it over to Dr. Zulfiqar, who is going to discuss with you more in depth, like the outline of the course and the timeline of this extended course as well.
Okay. Thank you, Dr. Khalid. Thank you, everyone, for joining us today. Since we are expanding our course, so we are starting in June 19th, and we are ending our course in November 14th. So what is the outline of our course? We are basically, because our course is expanding now, so we are dividing it into two phases. The first phase will be starting June to September, which has two components: live lectures and live practice sessions, which is what we call a bridging phase. So our students who already took the previous ACJ course will start with us and attend the new lectures that we added. Also, you will have access to previously recorded lectures that we previously recorded covering the previous topics. So what are the new live lectures? Basically, we will cover preventive dentistry, restorative and pediatric dentistry, oral surgery, and trauma, and divided into two lectures. Then we will have live practice sessions. These live practice sessions, we will basically cover all of the topics, not only the topics that we added in our expansion, but we will cover everything that we will cover in the ACJ. So basically, by doing this expansion, we are covering all aspects of dentistry, but in an ACJ point of view. So because this exam, as Dr. Marwan and Dr. Khalid said, is very dynamic, always changing, always adding new types of questions. And there is an unpredictable nature of this exam. So by doing this, we are basically eliminating or reducing the unpredictability of this exam. So going into this exam and taking all of these practices, there are basically no aspects of dentistry that you did not take practice on. So during the first 3 months of the course, you will take practice on radiology, preventive dentistry, restorative, oral surgery, in addition to the topics that we covered previously, such as ortho, medical management, pharma, pathology, perio, and so forth.
So I have a question for you, Dr.
Yeah, sure.
So we talked about people who already took the ACJ with us, and I know you guys have already touched on preventive pediatric. You guys covered it in the previous course. Now you're going more in depth and expanding that. But what about someone who wants to join as a new candidate in June?
Okay,
so I just want you to highlight that the pre-recorded lectures for the previous topics are available, so they can actually catch up.
Exactly. So what if you are a new student who is just joining our course? How will you able to attend these practices? How will you able to do these practice sessions? So we have pre-recorded lectures. Every student, by the way, we will have homework. So this homework basically is attending the practice or the pre-recorded lectures for next week's practice session. So for example, we have a medical management, pharmacology, and local anesthesia practice that will take place on June 7th. July 7th, sorry. Yeah. July 7th. On the week before, in our lecture on the week before, the participants will be informed that you have next week, you have a quiz on these topics. So you are required to attend the pre-recorded lectures covering these topics so you can successfully attend this practice session.
Now, will the candidates have the chance to attend them live, these sessions?
Of course. So this is where our second phase of the course starts. So after that first phase, from June to September, we will have the second intense phase, where all of the topics will be covered again in live lectures. So we will have more than 25 live lectures that will focus on all topics. So we will have one lecture or multiple lectures that will cover on all topics, including the new topics and the topics that we previously covered.
Okay.
In addition, we will have quizzes. What is a quiz? A quiz basically is a set of 20 questions that covers or focuses on only one topic. And after the quiz, we will have a quiz discussion. So for every quiz, we will focus on one topic, and we will have a quiz discussion that is focusing on that one topic, and also we will have a Q&A session. So basically now we are covering each topic separately. Now, because we want to make things more challenging, we start mixing up topics. So after finishing the quizzes, we will have weekly mocks. What is a weekly mock? It's basically half a mock exam. So every weekly mock will have approximately 60 to 75 questions that covers all topics, including radiology, of course. And it will be basically have the numbers of questions that you will see in a mock exam or in the actual exam that you will do. And after that practice session or after that weekly mock, you will have a live mock discussion, of course, with another Q&A session. And after that, because we want things to become, again, more challenging and we want to mimic the circumstances that you will see in the exam, we will have 4 live mock exams. So 4 full mock exams with 4 live mock discussions. And a set of a full mock exam is basically 120 to 150 questions that would cover, again, all topics, including radiology.
Okay, so just to simplify things, so when we are starting in June 19, the course, this is mainly targeting the audience of people who are planning to write the exam in November. And these candidates, either they already booked the exam in November and they want to join, so we advise them to join as soon as possible so they can take this expanded.
Exactly.
And of course, the candidates who were with us before and who are still waiting for November, then they are invited to attend. This is free of cost, the expanded, so they can join us, so they can actually increase their practice and prepare for November. Now, after Dr. Khalid talks about radiology, I'm going to also address a second type of audience, that actually our AFK candidates who are going to be writing the exam in August. Plus, those we wish everybody the best of luck, but always we get questions, those who do not succeed, what do we have for them in the ACJ, so we can discuss this at the end.
All right, so I'll just also touch on radiology. Dr. Dhulfiqar and mentioned it. So we will be having radiology discussions and radiology practice throughout the entire course. So if you, one thing we can take away from what the timeline or the outline that Dr. Dhulfiqar was discussing is that basically now the course is, you will be exposed to all of the topics from the beginning of the course for a very long period of time, or a period of 5 months. So including radiology. Now most of the exam, the bigger portion of the NDEB exam, maybe around 60% of the exam is radiology. So that's why it's very important to us that we have continuous radiology practice throughout the entire duration of the course, from June all the way until November. Also, this practice will include radiology live lectures, quizzes, weekly mock exams, and of course the full mock exams. So by the end of the course, you will have seen a large number of radiographs, over 600 radiographs in total, including a large variety of radiographs, a variety not just in terms of the findings in the radiographs, but also different qualities of radiographs, different projections of radiographs, different pathologies in radiographs, and so forth. One last thing I will discuss over here in this section is that if you've noticed, what we've done with the course is that we've basically tried to tackle 2 things, quality as well as quantity, and having this extended period of time will allow us to do that. So in the first phase of the course, we are having exposure to practice on all of the different disciplines. And in the second phase, which is a little bit more intense, we are tackling that all over again one more time, from the aspect of live lectures again for all of the different components, as well as more and more weekly mock exams, building up all the way to the full mock exams as well. One other very important aspect of the course, we believe, is having that one-on-one connection with the participants, because at the end, although the course is an online course, it's not like we just want to log in, give a lecture, go over the x-rays, and then log out. It's very important to us that we have that connection from the time you start the course until you get to your exam. And that connection means catering to the needs of every single person individually. So one thing that we also focus on is trackability. During the entirety of the course, you're going to be doing multiple quizzes, weekly mock exams, and so forth. And these will all be conducted on our prep test online platform. So we will always have access, or we will have an accumulation of data that is your progress throughout the course. How well are you scoring throughout the course? Are you actually doing the quizzes and the weekly mock exams or not for each individual participant, as well as the performance in the mock exams and how you are doing in the mock exams. And what this allows us to do is not only make sure that everyone is improving properly throughout the course, but it also gives us an opportunity to provide that extra push or any extra support that any of our participants would require. And one thing that we've implemented in the previous cycles, which we found to be very beneficial, especially for the participants and also beneficial for us, is that we, throughout the entirety of the course, we conduct one-on-one sessions with participants who would like to do so. So what we do is, anyone who would like to have a discussion with myself or Dr. Dhulfiqar, because we're the two instructors who teach the course, anyone who would like to have any discussions, we can easily book a 30-minute, sometimes even longer, 30-minute session where the participant can have this time to discuss anything they want to need. They want to ask about, whether they want to ask about certain topics, whether they want to get advice on how to prepare, whether they want someone to help them just through this period of studying. And what that does is it gives us this connection with the participants, and we found that it massively helps the participants in terms of providing all of the support that they need for the actual exam. So in that way, because it's an online course, which makes it very convenient, but at the same time, we take the advantage of having that personal connection as well.
Thank you, Dr. Khalid. And I even, to talk about, I remember one of the cases you had was a candidate who was struggling with time management.
Yeah.
Because going for the equivalency process and actually preparing for the exams, people have families, they have children, so time management and access to resources is one of the most challenging things. So sometimes all it takes is like a 10-15 minute advice on how to organize yourselves, how to prepare, how to make use of the resources that we have will make a huge difference, and we started to see improvement in the performance of our candidates.
Yeah.
Now, thank you, Dr. Dhulfiqar and Khalid. I'm going to talk here now about what we are doing here at Prep Doctors actually to help in this phase. So what we noticed that the equivalency process starts with AFK. AFK actually is the first step. People have a lot of energy. The people are excited to enter into this process because they're expecting that they're going to become licensed dentists, which they will. But then as they progress to the second phase, they start to get a little bit tired, and the period starts to prolong, and then they go to the third phase and they're actually exhausted on multiple levels, financially, and they're exhausted from an effort-wise. So what we want to do at Prep Doctors is actually help people plan for the end goal. And if you don't plan ahead, people actually run into problems, and we do see how people are getting stuck at the end, and we're trying our best here at Prep Doctors to help them out. But our focus, we've had a previous webinar, and the focus was on NDEC people who are actually stuck in the process to help them out. But we want to also give the advice to people who are going to ACJ, so they don't actually run into this situation and they can prepare ahead. So one thing that we have implemented here, and now I'm going to talk about in terms of management for time and financial. One of the challenges is people say, well, I have to prepare for ACJ. How many months should I prepare for ACJ? The longer the better. But when we say the longer the better, then the challenge that they raise is, okay, we don't have access, we can't attend the center here, and also we don't want to pay twice and 3 times for a course. We just we have limited resources. So the answer to that, what we have implemented at Prep Doctors is one, it is an online, so no matter where you are, you can actually attend the course. And we have implemented a new policy for ACJ due to the challenges that were actually imposed by NDEB in terms of access to seats and booking the exam. So you only now, if you take the ACJ with the Prep Doctors, you take it once. You pay once for this course. And when you pay once, you have access for up to 18 months until you clear this process. So for example, if you start June 19, you have 18 months after June 19 to keep attending all the updates, all the live lectures, all the recordings, attend all the practice sessions until you clear your exam, which this includes two types of candidates, and we're trying to eliminate one of them. The first type of candidates is those who don't get a seat. That means if you were unfortunate to get a seat, then you have access again for all the updates and for all the practices. And the second type of candidates, which we are trying to eliminate by the trackability and improving the one-on-one connection with candidates, is those who don't succeed in the exam. Even if you don't succeed, you still have access up to 18 months to come back and attend the updates and improve on your skill until you pass. So this is actually the first policy that we have implemented for this course. Now, we tackled two types of candidates here. We talked about candidates who are going in November, but there are also candidates who are appearing for the AFK in August. This applies to you as well. And for our AFK candidates, feel free to reach out to us, to reach out to client relations if you have any questions. Once you start ACJ, no matter when you start, you are going to be able at least to attend 2 live courses and to attend 2 sets of updated practice sessions as you prepare for your ACJ. Which means, and this is what to talk about the point of flexibility, no matter when you enter and sign up, there's always a library of recorded lectures you can catch up with and a live section of lectures that is ongoing. And these lectures will help you to catch up and to prepare the minute you decide you want to prepare. So that's actually the first policy that we have implemented, is ACJ pay once. Now, one thing that I want to point out, when people actually pass the AFK, this is when they start to actually go to the banks and the line of credit starts to open up for them, and everybody or most of people are aware of the CIBC help actually that is being given to internationally trained dentists. So the minute they pass AFK, they open up $35,000 of loan, and of course this loan actually is very high interest at this period of time. So what we recommend is these $35,000, use them very conservatively, try to save them, don't exhaust them in the ACJ phase, because if you actually exhaust them, then you're going to run into trouble when you get to the NDIC phase. The NDIC phase is actually very demanding phase in terms of tuition for the exam. The exams of NDIC are now, after the discount, $8,000 because the NDB reduced it by $1,000. The courses are demanding. You need actually to quit your jobs. You cannot work while preparing for NDIC because it's going to take the majority of your time. So you need to have that financial support in order to survive in the NDIC phase and finish it as soon as possible. While in the ACJ phase, because now people who finish the AFK, you have up to 9 months to go to the exam, so you can start easy. So you can actually pay once for the course and start preparing on your own pace, and you can have a part-time job. Some people can even have full-time jobs. Don't use the line of credit at this point. It's highly unrecommended unless you need it for living costs, because even though the ACJ phase, this is the phase where people are relaxed financially because they have access to 35, and that 35 is more than enough for ACJ. But once you pass ACJ, they release another 50,000, and the total 85,000 is not enough for NDIC. For some people, they start to run into difficulties. So save that, don't accumulate interest. And the second thing that we're helping with in Prep Doctors is not only pay once in the 18 month, but you don't have to pay upfront. It's a 0 interest payment plan over 18 months. So our course is $3,200. So you're actually going to have to pay $177 per month plus tax. So that's actually a very minimal. We have reduced the monthly payment to a minimum so that even when you engage in this process, there is no upfront cost that you have to incur, and you can just ease into the course and worry about just preparation. And at the same time, you can cover your financial cost, the living cost that you have to manage. And then once you actually sign up with us in the ACJ and you get this payment plan, that actually puts you into our system and you actually become qualified for the next phase. So when you start with ACJ, you get that 18-month payment plan for the ACJ, but then also this will unlock up to 30,000 of in-dec financial support that's gonna come afterwards, which is also gonna be zero interest and divided over 18 months. The 30,000 you don't get one shot, you get them in two bursts, 20 and 10. But this actually helps out candidates in the next phase. So what we are trying to help out our candidates is that prepare well, with the quality of courses to help you prepare. We are tracking people so that we push them and we give them the guidance so they can clear things from the first time. And at the same time, we do understand there is heavy financial restraints on people in this process. So we are actually helping out with, on top of the CIBC loan, Prep Doctors is actually providing the zero interest support for candidates, starting from the ACJ into the NDEC phase. So your ACJ is gonna be very minimal cost monthly. And then once you go to the NDEC, you're already in our system. So you pass ACJ right away. You can sign up for the NDEC products. And again, you enter into a payment plan that's zero interest, which is also going to be divided over a period of 18 months. And we are hoping, and our vision is that the candidates will be able to actually finish all the exams from one attempt. And after they finish the exams, they start to work as dentists. And now the payment plan is going to be a breeze for them because they already have went to the other side of the fence and they are of the high earning individuals. So I hope this session was beneficial for candidates. Of course, if you have more questions, feel free to reach out to our client relation, specifically Mr. Rafiq. You can ask questions on the products that we have, but we do actually highly recommend that people prepare for ACJ for a longer period of time so they can clear it at once, and keep your eye on INDEC when you are in ACJ. Actually, we are trying to get candidates to start to look at INDEC when they are in AFK phase, because this one step at a time is what's leading to problems when people come to the last phase. We want people to think of the overall process and from day one to think about getting the license in Ontario and knowing exactly how to plan your life financially and how to prepare for these exams. Any other comments you would like to add?
I think you covered it.
Okay. Is there any questions that we can take, Uthman?
Yes, thank you for the excellent overview. I think those were really exciting academic and financial announcements. But let's jump into a few quick questions before we end. So Dr. Milicic asks, what's the difference between the online and the online plus on-site ACJ?
Basically, our course, 90% of the course is an online course, which is the entire component of the course, the lectures and the weekly mocks and the quizzes, as well as 2 online mock exams. So if you've taken the course only, just the online component of the course, you will get the full course, including all of the weekly mocks, all of the quizzes, all of the live lectures, as well as 2 full mock exams, which are held online. Also, for every cycle, the 3rd and the 4th mock exams are only held on-site, so that component of online and on-site will include the additional 2 mock exams, the 3rd and the 4th mock exams.
So in simple, Uthman, it's pretty much there's 2 mock exams, the 3rd and the 4th, and these mock exams are held on site because it's going to replicate the experience of the candidates, and also it will give that live feedback, and they have direct access to the instructors in order to ask questions.
Okay. There are a lot of questions about elaborating in more detail about the updates that we make to the material. Will those new topics that we've just mentioned be, will there be materials specifically for that? What kind of updates do we have per cycle? Okay,
so I'll answer that just to elaborate. So let's say I'm just going to give a time reference here so people, because it's a lot of information and they may get overwhelmed. So let's say we start June 19. right? So June 19 until September. And why do we choose June 19 until September? Because people finish the AFK exam in August, so the new batch will start in September. People who join newly, they go most of the time into September. So from June 19 until September, for this cycle specifically, we have implemented topics which are preventive, pedo, surgery, and restorative. These topics are gonna be given live, okay? And meaning that we are going to have lectures on how to do treatment plan for pediatric patient, because there's differences between an adult and a pediatric patient. How to actually manage a space loss in pediatric, space maintenance rules. If we talk about preventive, one of the important topics is caries risk assessment and the preventive regimens. So these lectures, these topics are gonna be live, and they are, although they were covered before, but there's expansion. So more heavy cases on them, how to plan for them. Surgery, for example, we're gonna talk about the different designs of flaps for surgery, how to treatment plan, impacted wisdom teeth, and so forth. So that's the live component. But at the same time, the candidates will have access for unlimited replays on all of the other topics in this period, which is June 19 to September. And they are going to be assigned tasks, especially those who join newly. They will be assigned tasks that this week you have to cover those 3 pre-recorded and attend the live, because the next practice session is going to cover these components, so they can practice with us. Now, once we come to September, the whole course gets repeated again live. So all the lectures gets repeated live, and the updates that happen in each cycle are mainly in the cases. So people are constantly getting exposed to new x-rays and in new cases. Okay, so the practice is what changes, because the amount of knowledge is gonna be the same once we cover all the topics, but they start to get to new cases and they become more skilled at tackling cases, because ACJ is not more about studying, is more about application of knowledge to a case. So when we come to September till the exam, the whole course will get repeated and the practice becomes intense. Now people will go to the exam in November. What happens after November? A second cycle of expanded starts for those who couldn't get the November, and they are going to go to next year, May. So they can still continue. The idea is, if someone did not get a seat, let's say for the exam, one of the things that happen to candidates is the disconnection. When they're disconnected for a long period of time, then when they come to study again, it feels like they're starting from scratch. So we want to stay in touch with those candidates with the practice sessions constantly, so they're always fresh, they're always actually in the environment of the exam, so that when they come to the exam, it becomes easier and they will build the stamina and the tactics to actually tackle those questions. So what's being updated every cycle are mainly cases and x-rays. And for this specific cycle, those 4 topics are going to be expanded.
If I may add on what
Yeah.
Dr. Marwan said, since doctors are asking about the expansion and asking about the updates in materials, these new topics that we added, we will also add new booklets that focuses on these topics in more depth or in more details. So new booklets will be also handed out to students or doctors for all of the topics, of course, but there will be new booklets on the new topics that we added.
There's another question from Dr. Contreras and a few other doctors as well. If you are somebody who's taken the exam and you're now waiting for your result, what advice do you doctors have for people who are in that specific situation?
Okay, so I'll answer this question because those candidates will be in the transition to INDEC, and we hope and pray that they all clear the exam. So what they can do at this phase, as we mentioned, is 2 things. 1, get the loops measurement done. You don't have to order, don't commit financially yet, but at least reach out to the companies of the loops, get your measurement done, so that the minute you get your results a pass, you place the order, because loops, they take time. You can't purchase them on the spot. So you need them for the skills training down the road. So that's a very important thing to do. Familiarize yourself with the skills and the materials and the instruments that you need to purchase, because one of the things that happen to candidates is the minute they get the pass in ACJ, that's only when they start thinking about INDEC, and they end up losing at least 2 months of preparation for the index. No, while you're waiting for your result, start to prepare for the index in the sense of know what's ahead of you, know the nature of the exam. You can reach out to Nerling to ask about the material, the cost of the material, so you can prepare ahead. Reach out to loop companies, do your measurements, put the order on hold. So the minute you get the pass result, then you start executing the next plan, so you don't waste time. So that's my recommendation for those candidates. And one more thing, Uthman, I just want to mention, because the doctor asked if they're waiting for results. The minute the ACJ results are going to be announced, we are holding a live event in order to talk about the preparation for INDEC as well. So they can stay tuned, and on our social media platforms, we will announce the date. So they are more than welcome to attend once the results are released and they pass, so that they can learn on the next phase.
Yeah. There's a lot of questions about when to start. You know, should I start in June, or should I start in September? When should people be looking? Should they be starting immediately, or what are your thoughts on that?
I would say my advice here, and the advice of the instructors at Prep Doctor, this is our philosophy, is what limited people from starting as soon as possible in the past is financial and accessibility, because we had things on site, they cannot attend on site, or the financial, because they will preserve the course until right before their exam because they don't want to pay twice. But with the actual policy that is updated for ACJ, where now they have to pay just once for the course for 18 months, it's a very, very relaxed payment plan. They can access things online. There is no obstacle that is left for candidates that should make them wait. So start as soon as you want, because learning in a relaxed phase is way more efficient than learning in a stressed phase. So there's no point of waiting 2 months before your exam and start learning then. Why not start now? Let's say someone will say, well, I'm not going to be able to attend all lectures. No problem, they're going to get recorded. You have access to them later on. But learn in a slow pace and build your stamina for the exam. You're going to find yourself more relaxed when it comes to the actual exam date. And there's no extra financial cost on this. Plus, the accessibility is actually from your home.
Okay, I think we've covered most of the questions. Remember, doctors, there will be follow-up emails, social media posts explaining all of what was mentioned in this webinar today. And so look out for those to get more details. Unless there's anything else to add.
We covered all points, but again, if anybody has any specific questions, they're more than welcome to reach the client relation. If they they can even request if they want to have a one-on-one sessions with Dr. Khalid, Dr. Dulfikar, so that they can get more guidance on the ACJ. If it's about other products, they will direct them to the right resources. And we here at Prep Doctors, we're here to help. We want to make the process as easy as possible for candidates, to reduce the stresses and to help people organize themselves from the beginning so that they can have a smooth sailing boat throughout the process.
Absolutely. There will be more information about the financial aspects that Dr. Marwan mentioned, the course schedules, all of those specific details. We'll be emailing. It will be on social media, and you can always reach out, as Dr. Marwan says, to Rafiq and the client relations team to get more information. So with that, we'll leave it there. Thank you all for joining us. Thank you, doctors, for sharing your time with us.
Thank you, Uthman, and thank you everyone for joining us.
Thank you everyone for joining us.
Thank you.
Okay, and we'll leave it there. Thank you so much, and we'll see you in the next session. Take care, everybody. Bye-bye.